All right, so my article is entitled Treatment of Cyclic Vomiting Syndrome with Coenzyme Q10 and Amitriptyline, a Retrospective Study. My article comes from the BMC Neurology Journal, which has an impact factor of 5.117. Some background on my information here is that cyclic vomiting syndrome, also known as CVS, is a variant of migraines which is based on overlapping symptoms such as headache, nausea, and photophobia. CVS and migraines both respond to amitriptyline, which is a tricyclic antidepressant. Amitriptyline is the first-line treatment choice for prophylactic treatment of CVS. CoQ10 is an electron shuttle in the mitochondrial respiratory chain. This is relevant because mitochondrial dysfunction is thought to be a component of the pathogenesis of both CVS and migraines. Some previous research is included from 1997 by Anderson et al., who reported successful prophylactic use of amitriptyline and cyproheptadine in 27 patients ages 2 to 16 years of diagnosis. In 2005, Sandor et al. Reported successful use of CoQ in comparison to placebo in 42 migraine patients in a double-blind randomized placebo-controlled trial. So the objective of my study was to evaluate the efficacy of CoQ in comparison to first-line treatment amitriptyline in the treatment of cyclic vomiting syndrome, or CVS. So the study design was a retrospective anonymous survey study with treatment to treat. The setting wasn't any specific city or hospital system, but it was rather an at-home online 30-minute internet survey by SurveyMonkey that was used over the course of 1 year to gather data. Some inclusion criteria includes people of all ages, so pediatrics and adult, professional diagnosis of cyclic vomiting syndrome, completion of the 30-minute survey indicating professional diagnosis of CVS, Rome-3 and NAS-PGHAN diagnosis requirements. Some exclusion criteria includes no professional diagnosis of cyclic vomiting syndrome, subject that does not meet the Rome-3 or NAS-PGHAN diagnostic criteria, and subjects who started amitriptyline and CoQ at the same time, subjects who started CoQ and L-carnitine at the same time. So, all right, for the interventions. So, subjects and parents of the subjects were recruited by the Cyclic Vomiting Syndrome Association, or CVSA, over 1 year through email, CVSA website, newsletters, which were all sent to CVSA members and physicians. All patients remained anonymous, and 385 subjects completed the survey. Efficacy was analyzed with differentiation between episode frequency of CVS, episode duration, number of emesis, and nausea severity. A reduction of 50% within each parameter equals a positive score, and less than 50% equates to a negative score. Episode improvement was considered a positive score if one of the above parameters I had just mentioned was positively scored. So amitriptyline doses were categorized into low, which was less than 0.5 milligrams per kilograms per day, medium, and high, which were lumped into greater than or equal to 10 milligrams per kilograms per day. CoQ doses were categorized into low, which was greater than or equal to 10 milligrams per kilogram per day, and high, which was greater than or equal to 300 milligrams in patients that were greater than 30 kilograms. So patients less than 18 years were categorized to the pediatric onset group, and patients that were greater than or equal to 18 years old were categorized in the adult onset. So then for the primary endpoint. So primary outcome is to find a similar episode frequency of CVS, episode duration, number of emesis, and nausea severity between amitriptyline and CoQ. Secondary endpoints included reported episode improvement analysis and discontinued therapy due to side effects. Statistical analysis. So the chi-square test was used to determine if amitriptyline and CoQ had the same efficacy or different efficacies. So this study provided no power, and an alpha of 0.05 was indicated based on a 95% confidence interval. All right, as for results. So baseline characteristics. So there was 385 total subjects that participated in the survey. 249 subjects reported use of amitriptyline for CVS, and 82 reported use with CoQ for CVS. 63 of the total subjects used in combination L-carnitine with either amitriptyline or CoQ. 14 subjects utilized CoQ and amitriptyline at different times for treatment of CVS, but never at the same time. And a variety of doses for both CoQ and amitriptyline were used, but these were not relevant in the correlations found between the doses. All right, that's for number lost. So 18 subjects were excluded for lack of health professional diagnosis of CVS. 13 were excluded for not meeting both Rome-3 and NASPGHAN diagnostic criteria within the CVS survey. 63 were excluded for starting therapy on CoQ, amitriptyline, and L-carnitine at the same time. And lastly, 22 subjects were lost due to starting therapy on CoQ and amitriptyline at the same time. All right, primary study outcomes. So there were 4 primary study outcomes. The first was episode frequency of CVS. So 88 out of 162 subjects that utilized amitriptyline and 11 out of 22 that utilized CoQ showed a 50% or more reduction in CVS episode frequency. Next, we had episode duration. So 78 out of 155 subjects that utilized amitriptyline and 8 out of 22 that utilized CoQ showed a 50% or more reduction in CVS episode duration. Next, we have number of emesis. So 70 out of 154 of those taking amitriptyline and 80 out of 20 taking CoQ showed a 50% or more reduction in number of emesis. And lastly, we have nausea severity. So 68 out of 157 of those subjects taking amitriptyline and 11 out of 25 taking CoQ showed a 50% or more reduction in nausea severity. Overall, there was no statistical analysis done for each specific outcome that was reported. All right, so secondary outcomes. So we have 2 secondary outcomes. The first is episode improvement, which was an analysis that showed no difference between groups. So amitriptyline had a positive score of 72%, and CoQ had a positive score of 68%. Discontinued therapy due to side effects was the next secondary outcome. So 21% of subjects that utilized amitriptyline decided to discontinue it due to side effects. And there were no discontinuations from CoQ group due to the side effects. This resulted in a p-value of 0.007, and this indicates that significantly more people discontinued amitriptyline due to side effects as compared to CoQ. All right, so subgroup analysis. So there was an analysis on patient recommendations, where subjects were able to recommend the use of either amitriptyline or CoQ. So 77% of CoQ users recommended the agent, and 47% of amitriptyline users recommended that agent by stating yes strongly or just yes. So this indicated a p-value of 0.008. So what this means is that CoQ users had significantly higher satisfaction than those taking amitriptyline. Overall, the study showed that subjects were more likely to continue CoQ rather than amitriptyline at the time of the survey. And then as for the conclusions. So, as for the strengths of the study, so the study was consistent with the author's clinical judgment and knowledge that the overall efficacy of amitriptyline is good and corroborates the high frequency of side effects. In addition, the study was accepted by an ethics committee, Children's Hospital Los Angeles Institutional Review Board, who reviewed and approved the study. So as for the weaknesses, there is a long laundry list of weaknesses for the study. So patients that were less than 18 were grouped together as one group. This is a wide range of body types and sizes with different pharmacokinetics. So the study failed to calculate a power, which led to an inadequate number of adolescents. This forced the researchers to create less specific groups to analyze their subjects, such as a pediatric onset, which was just less than 18 years, and an adult onset, which was greater than or equal to 18 years. I thought that this was a weakness because, as we've learned in pediatrics, depending on if you're a neonate or if you're a toddler or if you're between the ages of 10 and 15, you have an entirely different body composition. So medications can work differently in your body. So it's just hard to compare such generalized groups. So the study also did not indicate which area of the world, such as a city, that the study was completed in. In addition, the study failed to provide statistical analysis for the primary endpoints. Next, episode improvement was far too widely categorized, as an improvement in one of 4 primary endpoints was enough to justify improvement in CVS episodes, and that seems a little bit too broad. In addition, there was no comparison between low, medium, and high doses of CoQ and amitriptyline. And lastly, the number of subjects taking CoQ and amitriptyline was widely uneven, which makes it very difficult to actually analyze. So the author's conclusion. The author concluded that this data supports the idea that CoQ supplementation can be efficacious in decreasing the severity of CVS episodes, while also displaying tolerability and acceptance to those who utilize it. So overall, the data from this study can be utilized for further studies that can determine the role of CoQ in the treatment of CVS. As for my own conclusion, the student's conclusion, in general, I believe that this is not a strong study. First, there was no power calculated, and therefore a legitimate number of subjects was not ever acquired, and therefore the study is illegitimized. Next, there was a very small number of subjects in the CoQ group as compared to the amitriptyline group. As I mentioned earlier, this creates a barrier in establishing a reliable comparison, especially since the study utilized percentage points. Overall, this study resulted in unreliable data. As for clinical significance, so clinically, this study does not have any clinical significance in the use of CoQ versus amitriptyline in treating CVS. More research needs to be done in establishing the exact mechanism of CoQ in the treatment of CVS, and ideally, there should be randomized controlled trials that demonstrate the different outcomes for subjects that use CoQ and amitriptyline for CVS treatment. All right, that is all I have, and I look forward to your questions. Thank you.